Okay, today we're going to talk about central nervous system infections, and I'm going to give you a quick overview of the topic. This is what meningitis would look like with the stiff neck and the posturing. And you can see the pus coating the brain in patients who have died of meningitis, the dilated blood vessels. It's actually an meningitis with the infection spreading into the parenchyma of the brain. And as you do an autopsy, you can see the brain coated with the purulence. And then when you look on closer section, dilated blood vessels, all that blue interface are neutrophils coming to the meninges. And so there's the neutrophils in the dilated blood vessels. So this is what meningitis looks like. So one way to think of meningitis is to think about neonatal meningitis. And what would be the bugs? Group B, strep, E. coli, and listeria, right? And then we screen pregnant women for Group B strep, so we're seeing more E. coli, and then listeria always shows up. Here's a child who survived the meningitis. And meningitis in general, especially with pneumococcus and meningococcus, what are the long-term complications? Hearing loss, right? Hearing loss and cognitive dysfunction. Okay, and then besides meningitis, Group B strep can cause pneumonia in the neonatal period. It's picked up from vaginal colonization, rupture of the membranes, and then nasopharyngeal colonization. It's a beta hemolytic strep. Here's the algorithms for checking pregnant women for Group B strep. Now, when you think of a meningitis in the older child, teenager, adult with petechia purpura, you think of what bug? Neisseria meningitidis, and then if you've seen this occurring 2 or 3 times, what would be the immune defect? Right, terminal complement, right, C5 to 9. So gram-negative diplococci, and you can get a vasculitis kind of picture, and if you have no spleen, your hands and feet can turn black and may need amputation, and this is what it would look like in those cases. And so these are fulminant meningococcus. We call that purpura fulminans, okay, purpura fulminans. Now, every year in the meningitis belt of Africa, they have outbreaks of meningococcus and also a little bit of pneumococcus. So if you go to those countries, you need a vaccine. Also, to go to Mecca, Saudi Arabia, for the Hajj pilgrimage, you need a meningococcal vaccination, and there's been examples of that infection spreading globally from those areas. So the next bug to think about is gram-positive diplococci. So this is strep pneumo. Our focus is really now in the adult at 15 to 24 age group. They're the ones getting meningococcus, college dorm dwellers, and the list is really growing in that area. So what happens is nasopharyngeal colonization results in bacteremia and then seeding of the CNS through the blood-brain barrier, and that's the mechanism that you can see how meningitis develops. Now, what percentage of people will have the Kernig sign and the Brudzinski sign? Less than 5% with bacterial meningitis. It's still worth doing, but you're not going to really see a whole lot of people with bacterial meningitis giving you those classic signs. Now, Decadron is given with the antibiotics, especially with pneumococcus, meningococcus, to try to prevent the large infiltration of white cells, which causes inflammation and further brain damage. So Decadron administration has been useful, and the biggest problem long-term, as we mentioned, is hearing loss. Now, for the pregnant women, they can have miscarriage with listeria, with a dead baby, granulomas infantum septicum, and of course meningitis can occur in the extremes of age. Now, listeria lives in about 60% of refrigerators of people that have had it, and you can find it in the hot dogs, the cold cuts, the coleslaw, and all kinds of places. It loves to grow in the cold. The classic outbreak was associated with soft cheeses, not hard cheeses, and there was one outbreak associated with Mexican soft cheese. So remember, listeria is an opportunistic, it's a gram-positive rod, okay? There's your gram-positive rod. It likes to go to the midbrain, okay? And when it goes to the midbrain, it may form these little micro abscesses. And we call that rhombencephalitis, and the CSF can be negative in over half the cases. And then it loves to go to placentas, and then of course it can get into the fetus, cause granulomas everywhere. It's called infantum granulomatous septicum. Now here's the granulomas in the placenta on cross-section, staining positive for Listeria. There's some more granulomas in the placenta. So Listeria, intracellular, it likes to move intracellular. It evades the immune system as it moves cell to cell, propelling itself. And so it's the classic intracellular pathogen. And there it is, happily living inside a monocyte and macrophage. So there's the Listeria living intracellular. Now, unlike other gram-positive rods, Listeria is beta hemolytic, just like Group A strep, Staph aureus, Group B strep. Listeria is beta hemolytic. The other thing Listeria does, unlike anthrax and diphtheria, is its motility. It has motility. So this is the motility test. You take semi-solid agar, you poke it in the middle with the little of the Listeria on this, and it gives you the umbrella as the motility sign, the umbrella sign. So who's going to get Listeria? The extremes of age, the very old and the very young. That's who's going to get Listeria. And now, the very old typically have other conditions that make them more likely to get it, such as a malignancy, kidney, liver disease, and diabetes. So the elderly with comorbid illnesses typically are getting it. This is the famous Mexican soft cheese outbreak reported where pregnant women, neonatal deaths, etc., and miscarriages were occurring, stillbirths. Here's the example of how Listeria goes through the GI tract into the bloodstream and seeds the placenta or the brain. Now, in the world of bacterial meningitis, if I ask you to name the bugs, most of you could tell me, well, strep pneumo, Neisseria meningitis, H flu is sort of gone by the wayside because of the vaccine. And yes, we got to think of Listeria, but most people don't think of this one, which is Staph aureus, which is almost accounting for about 10% of all of our bacterial meningitis cases, okay? So a good regimen to put someone on when you suspect bacterial meningitis is vancomycin and ceftriaxone. You will cover everything except Listeria, so then you would have to add ampicillin. However, if you really want to do it with two drugs, meropenem covers all of them with vanco for the MRSA in case it's Staph aureus, okay? So meropenem covers Listeria and it covers the rest of those. Now, some people have said, when do I worry about Listeria in the adult? When you're over 50 or you're on chronic steroids, a bunch of other comorbid illnesses. And then yes, they can even have gram negatives also, usually from an obvious source, urine or somewhere else. Now, what's the most common cause of aseptic meningitis? Cultures are negative. What's the most common cause? What's that? Enterovirus, right. So echovirus, Coxsackie, enterovirus are the most common causes of aseptic meningitis. Now, how do you get enterovirus? Well, you get fecal-oral spread, so how do you think you're going to pick it up? Well, here's an interesting outbreak that occurred at a swimming pool RV park where there was an outbreak associated with a crowded swimming pool. So there was also a group went on a mission trip to Mexico. They swam in the ocean, and many of them got aseptic meningitis because it actually can live in salt water. So water, other areas, enterovirus. Now, aseptic meningitis, and there's a pet rodent, hamster, gerbil. What's the virus? We had to kill all the lab rats at our lab at USF because it was infected with this virus. This virus can infect transplant patients and kill them if you donate organs, heart, kidney, and the guy actually is infected with this, which has happened. So, who knows the virus? There's no treatment. It's lymphocytic choriomeningitis, also known as LCM. Now, let's say you're going on a cruise, you stop in Kingston, Jamaica. The beaches look gorgeous, you have a great time, you're eating, and you eat a salad. It looks fine, it tastes fine, there was nothing wrong with it, but you now have eosinophilic meningitis. classic story for what? Angiostrongylus cantonensis. And what the heck is that? The rat lung fluke. So it looks like that. So that's the rat lung fluke. What happens is the rats, which was endemic in the South Pacific like Tahiti, traveled on ships. Now it's in the Caribbean, all the way through the Caribbean islands. And the rat defecates. The larva gets into the snail. So guess what? There was outbreak in China eating poorly cooked escargot snails. However, the outbreak in Jamaica was associated with the snail crawling on your lettuce, and it wasn't washed. So the big thing was washing the lettuce, and then you eat the salad. Okay, so that was the cycle of Angiostrongylus cantonensis. Okay, and then if you don't want to take my word for it, here's the example of the outbreak in the cruise ship in the Caribbean, and the positive 23 U.S. tourists, 12 persons were sick. Now, what's the #1 cause of aseptic meningitis in the world of medications? Ibuprofen. What's #2? NSAIDs, Bactrim, anti-rejection drugs, okay, INH. You should know your drugs that cause aseptic meningitis. So keep that in mind. Now, with aseptic meningitis, you get all the symptoms that you get with bacteria, but typically your mental status is intact. That's not affected. And then the big difference they tell you on the CSF is the glucose is normal with virus and low with bacteria. However, there's 2 exceptions. Mumps and LCM can be low with glucose. Okay? Now, this guy has a rash starting on his hands and feet, spreading all over his body. And it looks like this, and this, and that. So what does he have? And he was bitten by this. So what's your diagnosis? Rocky Mountain spotted fever, right? Treatment is doxycycline. Where are you going to see it? The top states: North, South Carolina, Oklahoma, Missouri, Arkansas. Okay, this person has oral ulcers and genital ulcers, aseptic meningitis, uveitis, pathergy, and arthritis. Pathergy means that their skin gets more inflamed when you traumatize it. Give me your diagnosis. Right, and there's your pathergy. So this is Behçet's syndrome, okay? So it's not an infection, but it can give you an aseptic meningitis. What about someone who's had 5 cases of aseptic meningitis over 20 years? There's the culprit, those epithelioid-looking cells. What's the diagnosis? Any thoughts? So this is Mollaret's meningitis, right? Mollaret. And what's the cause of Mollaret's meningitis? It's actually herpes simplex. By the way, Mollaret cells can also be seen with West Nile, so the cells themselves are not pathognomonic. This was the famous outbreak. Mollaret's meningitis is also called benign recurrent lymphocytic meningitis. In the world of PCR, when that came out, we now have a way to test for it. So it's due to herpes simplex virus, okay? And then how can you explain it? Because the herpes is living in the sacral ganglia, and instead of going antegrade, giving you genital herpes, it keeps going retrograde, giving you aseptic meningitis. So you put them on chronic prophylactic acyclovir. Okay, this guy has a large meningioma, presenting with 8 months of loss of vision, headaches. We cut the thing out, and something is dripping out of his nose. So how can you tell if that's CSF or nasal secretions at the bedside? You can do what? Check it for sugar. AccuCheck glucose, positive CSF, negative nasal secretions. Put it on a filter paper. If it gives you a halo, think CSF, right? So this is called post-surgical meningitis. And what are the bugs? Not strep pneumo, not H. flu, not Neisseria meningitis, gram-negative rods like Enterobacter, Pseudomonas, and of course MRSA. So what are you going to give them? Vancomycin, Vanco plus cefepime. If you don't like Vanco, Zyvox works great, penetrates blood-brain barrier, and I love it even greater than Vanco, okay? So there you have the nice pearls to treat this. This one's a gram-negative rod. Now, if someone keeps getting recurrent pneumococcal meningitis and they had a car accident 10 years ago, can you explain that? Fracture of the cribriform plate. So keep that in mind as well. Now, chronic meningitis by definition is symptoms more than 1 month. Number 2, cranial nerve palsies. Number 3, base of the brain inflamed. What is the #1 cause of chronic meningitis? Tuberculosis. TB. What's number 2? We'll talk about that in a minute. See the TB? Now, we treat this with ripe therapy. What are you going to do to prevent a little hole there from getting clogged up, causing hydrocephalus? What are you going to give them? You see that hole there? If that gets clogged up, they get hydrocephalus, and it likes to cover the base of the brain. So you're going to give them steroids. And with cryptomeningitis, which is the second most common cause of chronic meningitis, you're going to do what to prevent hydrocephalus? Serial lumbar punctures to reduce the pressure. But in the non-AIDS patients, you can actually give them steroids, just like for TB. Okay? You notice how TB likes the base of the brain, the caseating granulomas, the AFB positive. Guess which bug this is with the capsule and the pinched bud? That's Cryptococcus. Cryptococcus likes the ventricles, base of the brain. Who's going to get it? HIV, lymphomas, leukemias, and even people who don't have cancer. Now, chronic meningitis, the list is long, but TB, crypto dominate. Okay, so chronic meningitis. And then don't forget your meningitis drugs that have good penetration. Do you need to cover for herpes encephalitis? Do you need to cover for listeria or gram-negative rods? What do you need to cover for? You have to have the correct diagnosis to know which antibiotic to order. Now, brain abscesses, those typically are what kind of bugs cause brain abscesses? Not strep pneumo, not Neisseria meningitis. So Staph aureus, Peptostreptococcus, anaerobic strep from the mastoids, the sinuses, even gram-negative rods going to your brain. So a good coverage would be Vanco or Zyvox plus Meropenem to cover all your bases. So here's your brain abscess, okay? See the brain abscess? And there's the wall of the abscess, the necrosis, and there's the organism Peptostreptococcus causing brain abscess. Now, this guy was picking strawberries right down the road, and now he is seizing, and he's from Mexico. What's his diagnosis? He eats tons of pork. Neurocysticercosis. Now, an Orthodox Jewish family got neurocysticercosis and they don't eat pork. So how did they get it? The people that were preparing their food were from Mexico and they got it from fecal-oral contamination of the food. So you don't have to get it eating pork. It's contaminated food. Most of our neurocysticercosis in the United States comes from Mexico, but other countries can also, be endemic for neurocysticercosis. AIDS patient with multiple ring-enhancing lesions, diagnosis is toxoplasmosis. Treatment is pyrimethamine sulfadiazine. Allergic to sulfa, what are you going to use? Clindamycin. Give him B6 as well. This is a patient who died of toxo post-transplant with those micro abscesses. There's the tachyzoites of toxoplasmosis. Now, AIDS patient, one big giant lesion in the brain. Right, CNS lymphoma, usually Epstein-Barr virus related. And then in our bone marrow and leukemia neutropenic patients, you can see aspergillus presenting as hemorrhagic infarcts, and those are the hemorrhagic infarcts growing in blood vessels. Now, this person has aphasia, sexually inappropriate behavior, and confusion and fever to 104. What does she have? Lights up the temporal lobe. Herpes encephalitis. Thank you. Herpes encephalitis, if you don't get treated, it's going to necrose your temporal lobe. So herpes encephalitis, most common cause of fatal sporadic encephalitis worldwide, 10 to 20%. of all encephalitis in the U.S. 1 is the most common. 2 causes more of a global encephalitis. Rapid onset fever, headache, focal deficits, mental status changes, route of entry through cranial nerve 5 or olfactory or viremia, temporal lobe predominates. It is not NOT more common in the immunosuppressed versus the immunocompetent. Much of the brain damage is because of the immune system. So Germany is doing a trial trying to see if giving steroids will improve the outcome in addition to antivirals. The encephalitis is a slow evolution in the immunocompromised. The viremia did not correlate with the severity. You get all kinds of focal deficits. You can have weird things like emotional control, Kluver-Bucy syndrome, amnesia, and then the sexual inappropriate behavior, hypersexuality. All these things can occur with the temporal lobe involvement, and the treatment is high-dose acyclovir for 14 to 21 days. Now, in our transplant patients, don't forget HHV6 can cause encephalitis, and that one's another one. And most of us have HHV6 in our body since the age of 2 or 3, as you can see, these people who pick it up then. So when you think of HHV6, think of transplant. You may find it in the blood as well. Reactivation is common in the blood. We don't really see a whole lot of cases, nor does it require treatment in many cases when it's in the blood. But encephalitis has occurred and it has been published. Now, the treatment is foscarnet pervert over ganciclovir for HHV6, and you can follow the quantity in the CSF. There is no resistance testing. Don't forget, of course, CMV encephalitis. You see that HIV, and of course, transplant. Anybody who's cellular immunodefective, and you might want to actually give them the combo of ganciclovir and foscarnet. And yes, you can follow the PCR CMV for response to therapy. And then in really tough cases, you may start to think of weird treatments like the artesunates, marabavir, intrathecal treatments. Now, this person, AIDS or CLL, progressive demyelinization over several months. That one, of course, is PML, progressive multifocal leukoencephalopathy. JC virus, it's a demyelinating illness. It's a cousin of the BK virus, which causes hemorrhagic cystitis. Most of us picked it up in childhood. It's laying dormant in our kidneys and our lymphoid organs, and then when you get cellular immunodefective, it can reactivate. Now, it was mostly described initially in those lymphomas and lymphoproliferative disorders. The prevalence is quite low, but it's quite severe. And with HIV, it was probably got a lot more play in the literature. And most of the older reviews have mostly AIDS patients and then bone marrow and heme malignancies dominating. However, that's all changing because the monoclonal antibodies, the immune suppressing drugs, are all causing increasing cases of PML. So you have to be aware PML is on the increase, and you can get all kinds of CNS abnormalities, seizures can occur. The median survival, unfortunately, is 2.5 months. PML survivors, if they do survive, they are left with severe neurological sequelae. And yes, you can get the immune reconstitution inflammatory syndrome with PML, with treatment of HIV. And you want to look for that demyelinization on the MRI. You may have to do a brain biopsy because the PCR for JC virus is not 100%. And the biopsies are fairly benign, but they have to be kept into consideration. And you can use the JC PCR quantitative level for response to therapy. Now, what is therapy? Well, there's not a whole lot out there. You can get rid of their immune suppression. You can give them Ara-C, but it doesn't work well. Cidofovir doesn't seem to work. Topotecan doesn't seem to work. And we have one case we're publishing on interferon alpha that successfully worked in a ALL patient. So, and then most people agree, give them Decadron with a slow taper because of all the brain inflammation. Now, if you have a rash on your hands, feet, and then you develop encephalitis and die in a nursing home demented 20 years later, what do you have? And what kind of syphilis? General paresis, right? And it affects your spinal cord and you lose proprioception due to syphilis. We call that what? Tabes dorsalis. So general paresis, tabes dorsalis, those are your main syphilitic CNS effects. Now, if you're bitten by a mosquito in the United States, including our state of Florida, and you develop cranial nerve palsies and you're a healthy 20 or 30-year-old, and your spinal cord lights up, what do you have? West Nile, and you have the polio-like presentation, right? So humans are incidental hosts, and transmission can occur other than mosquitoes via these routes. Remember, the CNS disease is only the tip of the iceberg. Most are asymptomatic. You may get some fever, some meningitis, some headache. So West Nile fever, most never get diagnosed, but the antibody titers could be positive. Meningitis aseptic can occur. And then the full-blown encephalitis with all of the cognitive dysfunction. Don't forget this one, flaccid paralysis, polio-like illness, 20-year-old. Excellent prognosis for this one. The other one's encephalitis is, you know, if it doesn't kill you, you're left with brain damage. And the diagnosis is with the serology, and you can treat it with probably the interferons, and the immune globulins are being investigated. Now, remember, the elderly, immune suppressed, severe disease, 10-20% mortality, they don't do as well. The paralysis people tend to have a pretty good recovery. And then these are the places all over. It was associated with the economy out west. And how did the economy affect the increase in West Nile? If you're reading your Emerging Infectious Disease Journal, it was associated with foreclosures on homes, swimming pools left unattended, mosquitoes brewing, increased mosquitoes biting. Okay, so West Nile activity, all the states sort of represented in the continental U.S. Now, don't forget St. Louis encephalitis. It occurs in Florida every 20 years, and we're overdue, by the way, for another epidemic. And we do have some cases, and we have our sentinel chickens in the county looking for these cases. Okay, so this is another one to keep on the lookout. What's the one with the highest mortality with most cases occurring in Florida? Answer is Eastern equine encephalitis, 60-70% high mortality. Now, if you visit India or Sri Lanka or somewhere out in Asia, and you did not get vaccinated and you have chorioathetoid movements with encephalitis, what do you have? What do you have? In red, see it? You have Japanese encephalitis, okay? So vaccine preventable. Think about all the encephalitides spread by mosquitoes. Don't forget the ticks, that's a big one, tick-borne encephalitises. You can break them down into their classes, the enteroviruses, the arthropod-borne, etc. Now, if you are skiing, diving off a bridge, tubing, Georgia, Texas, Florida, summertime, and then get encephalitis, and it typically likes the frontal lobes, and there's the organism eating the frontal lobes of the brain. So what is that? Amoeba. And what's the most common amoeba? There's the amoeba. Actually, the most common is Balamuthia, but the most pathogenic is Naegleria fowleri. The third one that more causes skin and corneal is acanthamoeba. The treatment is antifungals, ambisome, voriconazole, things like that. Okay, so Naegleria fowleri is the one we always blame it on. Now, if you get a rash all over your body and then you get encephalitis and die, what do you have? And you have Koplik spots. Measles, right? What do you have if you had measles 15 years ago and then you slowly die? You have SSPE. What is that? Subacute sclerosing panencephalitis. Now, what if you're a kid and you have an optic neuritis and you had a vaccination or viral illness 6 weeks ago? What's that called? What's it called? More in kids than adults. You have ADEM, right? Acute demyelinating encephalomyelitis. Used to be called post-viral, post-vaccination encephalitis. It's an autoimmune kind of thing. You can get all kinds of symptoms, as you can see there with ADEM. The CSF is sort of non-specific. You will see possibly some demyelinization on the MRI. And what do you want to give them? Good old IVIG, possibly steroids, and pretty good response to therapy. Now, Moffitt, common phenomenon, encephalitis, posterior part of the brain involved. What do they have? Press, right? What's press? Posterior reversible encephalitis, cleared up nicely with stopping the drug. So press, posterior reversible encephalitis, has many causes. The big one here is the cyclosporin tacrose, cirrhosis, so bone marrow patients, leukemia patients, other cancer patients getting chemo, and even non-cancer patients can get press. So there's lots of press causes out there. Okay, what's this animal? And someone, you said it was flying around my bedroom. What do? Well, that's debatable, but this is what you're trying to prevent. What is that in your brain? Rabies. And what are these called? Negri bodies, okay? By the way, they always said if you find a bat in your bedroom or whatever and you slept there and you don't know if you were bitten, you should get vaccinated. Other people are saying the risk is 1 in 5 million, but we still vaccinate because the mortality is so high. Okay, so this is the Negri bodies, and there's the Rhabdoviridae. Now, what are the most common animals in our area? Raccoons. Other areas are skunks, coyotes, foxes, and what's not on the list here? Bats. Bats, okay? Now, do you know what these animals look like? Can you identify them? This is a raccoon, a fox, a coyote, and a skunk. Okay, so remember those. Now, what is the most common animal to cause rabies in the red areas on this map? The dog. Okay, the dogs. But in the United States, it's rare in a dog because they're all vaccinated. Okay, this guy's on the island of New Guinea. He ate his dad's brain when he died 30 years ago, and now he has progressive paralysis. What does he have? Kuru. This guy's in a nursing home and he has the startle response when you wake him up, and he has holes in his brain that look like a sponge. What does he have? Creutzfeldt-Jakob disease, and think of the startle response, okay? Creutzfeldt-Jakob disease. Okay, this guy has a lab monkey, and the monkey is sick with encephalitis and bleeding from his orifices. And this monkey came from a river in Africa. What's the name of the river? There's also a city in Germany where it's named after. So the river is Ebola, and the city in Germany is Marburg. These are filoviruses. They look like shepherd's crooks, and you have DIC bleeding, and then death ensues, and then you have to quickly bury the patient because the family wants to prepare the body, and then they all get infected. So that's the hard part, is no, you cannot let the family prepare the body. It's contagious. You have to quickly bury them. Okay, so high mortalities, up to 70%. What's the reservoir for Ebola and Marburg and Nipah virus, which causes encephalitis in pig farmers in Southeast Asia? And SARS, the fruit bat. Okay, caves, fruit bats. Okay, encephalitis, got back from Africa. Things in your red cells, malaria. Okay, malaria. And then what about safari, Kenya, tsetse fly, winter bottom sign, sleeping sickness, trypanosoma gambiense, rhodiense. Raccoons, kid gets encephalitis playing in the sandbox. That's Bayless ascaris. Kid in sandbox, raccoon, Bayless ascaris. Treatment, albendazole. Sub-Q nodules all over the body, person on steroids, nodular pneumonia, brain abscesses, gram-positive filament, this rod-modified acid-fast positive. Nocardia, gram-positive filament, this rod and lung, going to the spine, going to the brain, modified acid-fast negative. Actinomycosis, so those are the two lung-brain abscess connections, nocardia, actino. And then, of course, aspergillus, lung nodules going to the brain, but more hemorrhagic infarcts. And there's your aspergillus. And then, of course, diabetic ketoacidosis starts in the sinuses, goes to the frontal lobe of the brain, mucor zygomycosis. If you step on a nail, you have the rhizus sardonicus smile lockjaw. That's tetanus, subterminal spore. And this is called what? Opisthotonus, which is neonatal tetanus. Total body posturing for total body tetanus. This person has progressive paralysis, is heading on a ventilator, and they ate some contaminated food. Botulism. What did the baby eat that gave him neonatal botulism? Honey. It's a pure motor neuron problem. Monkey bite, encephalitis, 8 weeks later. What's the bug? All monkey bites get prophylacted with Valtrex Famvir. That's your hint. Herpes simiae or